Hmm. Ann, are we good?
We are live.
We're live?
Mm-hmm.
We're live. Okay, here we go. Hello, it's 4 o'clock Pacific, 5 o'clock here in Costa Rica, 7 o'clock on the East Coast, midnight in Dublin, 1 a.m. in London, Milan, Warsaw, and most of Europe, 4:30 a.m. Wednesday morning in New Delhi, 9 a.m. in Brisbane, 11 a.m. in Auckland, and it's Facebook Live. And our guest, Julie Matthews, just had to shut down her computer. The camera just stopped and she couldn't get it back on. So she'll be here in just a minute. So I just want to say hello to everyone and tell us where you're coming from and what time it is if you're outside the US. And your questions, you can start putting your questions in the chat area. No, or in the Q&A, in the Q&A.
Q&A for Zoom and comments everywhere else.
Okay, good. And then we'll put them into a document that I can see. And today's topic is about the brain and brain development, brain deterioration. You know, I just had the wonderful experience of interviewing Julie Matthews. I brought a film crew to San Francisco yesterday morning, and I interviewed her. And then I interviewed Dr. Dale Bredesen, who wrote the book, The End of Alzheimer's, in the afternoon. So there was a great day about brain function and brain regeneration at the early beginnings of life and at the end of life, towards the latter years of our life. And this is going to be a docuseries that'll come out sometime, probably November. I think we're going to do it in November. But it was great to talk to Julie and Dale Bredesen. Here comes Julie. And we'll just wait for her to come on. And then I can introduce her. So, Julie, looks like your camera's not working yet.
Yes, I'm going to try my other camera because this is what kicked me out the first time. So I'm going to use this camera and we're going to hope that I don't get frozen again.
Great. Well, hello and welcome.
Thank you.
Yes, so let me do a little introduction here of Julie Matthews. I just get my glasses so I can make sure to not miss anything. Julie Matthews is a certified nutritional consultant and published researcher specializing in complex neurological conditions, particularly autism and ADHD. She's the author of the award-winning book, Nourishing Hope for Autism, and co-author of a study on nutrition and diet for autism. And that study came out a couple of years ago, and it's fabulous. It's a fabulous study for every parent and every clinician. And we'll make sure that article is available to you. Julie's approach is based on the bio-individual nutrition needs of each person and stems from her 20 years of work with autism. Julie supports families and clinicians with her nutrition learning tools and professional training courses, and we'll have her link there. And she has an event coming out that we're going to talk about also, and we'll put the link there for that. So with that, hi, nice to see you.
Hello, good to see you.
Thank you. So a first question, people don't know, what's the difference between autism and attention deficit?
Oh, well, that's a great question. So there's a spectrum of autism. It doesn't involve ADHD. Autism is usually defined with a variety of social, cognitive, language challenges with language and certain repetitive behaviors and things like that. Whereas ADHD is more of attention, focus, hyperactivity, depending on what someone has. Now, in my view, I actually started my nutrition studies studying ADHD. And actually that led me to autism because a lot of the same underlying conditions underlie many of these neurodevelopmental delays or neurological conditions. So there are, I think, you could think of it as almost like a spectrum of neurological conditions, not that they're the same or diagnosed the same, but they have a lot of similar underlying things like digestive function, immune system challenges, mitochondrial function, inflammation. So I guess that's a little bit about how they're similar and different.
Got it. Thank you so much for that. Got it. The first question that came in our Q&A is from Gaia, and she asked, what's the recommended list of baseline tests that you advise right away to evaluate the potential impact of gluten on the brain health of a patient? Wheat Zoomer and neural Zoomer, question mark. And what about Cyrex Array 3? Question mark. So Julie, when you're working with your clients, are you doing blood tests on them?
It all depends on I train a whole bunch of different practitioners, and everybody's got their own scope of practice with what they're doing. So I tend to work with a lot of my clients that are working with functional medicine doctors already. So yeah. I often don't run those tests myself. I often work with the person's physician who's running a lot of those different tests typically.
Which is really great. That's just so excellent, because on stage I'm saying all the time that physicians don't have time to talk about nutrition, and they don't answer questions thoroughly because it's not their field of study. They may have some peripheral knowledge, but it's critically important to have a nutritional therapist who's properly trained, or a registered dietitian who's properly trained, or a health coach who's properly trained, so that they understand this field and can guide people, kind of hold their hand and walk side by side with them as we're asking them to change their lifestyle, eating the most common food that people eat, which is wheat.
Yes,
but to the question, it's the Wheat Zoomer and the Neural Zoomer Plus. The Neural Zoomer looks at 8 markers of inflammation in the brain. The Neural Zoomer Plus looks at 53. So that's a much more comprehensive test. And yes, those are the two. Every person that I work with gets those 2 done. And then probably others like the Dairy Zoomer or Lectin Zoomer, things like that. And then the question was, what about Cyrex Array number 3? Good test, did hundreds of them. And when the Zoomers came out in January of 2016, we moved over to the Zoomer tests. My experience is they give me more clinical information, and the laboratory testing suggests that they are more sensitive and more accurate. So the Zoomer tests are the tests of choice that I recommend on stage all the time. Great. So, Julie, let's see. The next question here, I need my glasses. Toddler twins, both with autism or Asperger, very picky eaters, gluten-free, dairy-free, but unfortunately not whole food diet. Mom's struggling a lot, feels overwhelmed, and doesn't know how to integrate new food because they ignore it. Cannot effort professional help. Any suggestions?
All right. Yes, I love this question because it's so common to so many people. So developmental delays and autism specifically, about 80% of kids are picky eaters. So realize that you are not alone. And there's a lot of potential reasons for that. What I like to do, a couple things. Toddlerhood, firstly, is kind of, I don't want to say notorious for picky eating, but it's very common. It's a developmental stage that toddlers go through, and to be somewhat of picky eaters with new foods. So there's that. But your children better than anybody. So if you're feeling like this is going beyond that, and that might have something to do with also their delay, actually, there's an event we're going to talk about in a moment, and I interview a woman who is a specialist in picky eating, and she talks a lot about how difficult feeding actually is and the number of developmental processes that you have to have in place to be able to actually to be able to feed or eat and, handle certain textures and be able to chew and swallow and all those things. So she actually gives some great feedback in that from a developmental perspective. I like to look at feeding from two perspectives. One is biochemical, and the other is what can we do? And I like to look at texture. So one of the biggest issues I find is sensory sensitivity and texture issues. So
Right.
I love to look at how can you work with the textures they like. Some of my clients will eat only, pancakes. So, but they would eat anything in a pancake. So their parents could puree chicken and vegetables into the pancake. And other people, they liked crispy and crunchy. So it was carrot chips or kale chips or rutabaga fries or things that are going to be more crispy and crunchy. So looking at what texture your child likes or your children like and trying to work within that, I think can be really, really helpful. And sometimes it's something new and unfamiliar. So if they're not used to green things, you start with kale chips, which are crunchy, then you might be able to get to more green things in the future because they have this small baby steps towards more green things. Or maybe it's any vegetable at all and they don't like orange foods. And so maybe you start with carrot chips or something. So those are some of the kind of things I think can be helpful. Sometimes it's changing the visual presentation. If they love dinosaurs, making little dinosaur pancakes, then making those dinosaur pancakes with some pureed vegetables in them. Those kinds of things I find to be helpful. The other thing I think can be helpful that sounds like this mom has already, or parent has already done, which is look at gluten and dairy, because they can form opioid compounds that can fit in the opiate receptor. And we know opiates are very addictive. So that's one of the biochemical factors. There's also certain nutrient deficiencies. And so we'll talk more about some other resources and things I'm doing in a couple days. Or we can come back to these questions, but I want to make sure I'll go with Tom's lead and whatever we have time for, we'll do and jump into as much detail.
Great. Thank you so much. Helen's here from Calgary. Hello, Helen. And she asked the question, what can we do in the classroom as I see many students with attention deficit, mental health issues, and autism in school-age children who can't function? What can we do in the classroom?
Oh, I love that question. I would say one of the best things would be if you can have some sort of policy around food in the classroom. I find that so many times rewards are given out or birthday parties, and they include not only sugar, but artificial additives and things like that. And that can really, we know from studies that artificial colors and flavors and preservatives really can affect hyperactivity and behavior and learning. So I feel like that's a really easy one, is that if you're going to do any sort of celebration, to see if it's possible to choose healthy things for the celebration, or figure out a way. I don't know if, some schools, it's like you don't bring your own party things from the outside, but maybe the school provides something, or you have I don't know what your capacity is for rules for parents and what you can say and not say, but I know that sometimes teachers will give out treats and candy. And that's one thing that I think is super easy to take out of the classroom and can go a long way. Again, all depends on if you do snack time. Some after school programs will do super healthy snacks that don't involve gluten, and we'll do rice cakes and red peppers and hummus and things like that. So I think it depends, in what capacity, but I think there's lots of great things. I love that question.
Great. An anonymous question on Zoom was, would you speak to neuroinflammation and attention deficit and how to approach dietary support?
Ooh. So neuroinflammation is really an underlying factor, I think, in all neurological conditions. In fact, inflammation is pretty much at the root of all chronic conditions. And so looking at inflammation, I think, is really beneficial. And I think one of the good things here, good news, is that food is something that we have to eat daily that can either cause inflammation or reduce inflammation. And so we have a lot of control over that aspect of inflammation in our lives. There are other things that are a little more difficult to have control over, but that one we have control over. So figuring out, are there any foods that could be contributing? So is it gluten? Is it dairy? Is it another sensitivity? I do a lot with things like salicylates and oxalates and FODMAPs that can cause inflammation. The key there is figuring out on that personal bio-individual level what is causing inflammation for an individual. We don't want to overly restrict a diet. And so that's a lot of what I do in my work, is help people figure that out. And as we were saying earlier, I'll be sharing a little bit more about my forum, and in it, I'm going to be doing tips for beginners and picky eaters and biochemical things that can affect them. And I'm going to be talking about how to work on a personalized nutrition plan with some of these more specialty therapeutic diets. So I think that's one aspect, is take out the inflammatory things and then add in the anti-inflammatory, good quality fats, good quality produce, fruits, vegetables, things that can help to reduce inflammation.
Marvelous. Thank you. The next question asked me if I could, I just read it. Let's see. Where did I find it? Can you offer references to share with our conventional pediatrician linking nutrition to improve mental health association with ADHD, anxiety, and autism?
Absolutely.
So,
As Dr. Tom knows, this is probably one of my favorite things. I love science. I'm working on getting another paper published right now. It's one of my favorite things to do, is do research and not only conduct scientific research, but read it and write about it. It's something I guess I feel, I don't know. I love it. I just love it. So yes, absolutely. I have tons of resources. I have free resources. I have books. I have all sorts of things. I have a free guide that's actually part of the summit and this forum I'm doing. And it's actually the science behind ADHD and autism and why food and nutrition can help. So there's a ton of scientific references in that, looking at, what are the underlying mechanisms that add to inflammation? What are the underlying mechanisms that can lead to ADHD or exacerbate ADHD and autism? And then what are these nutrition solutions, and what is the research that we know that can help improve it? So there's a lot. I have a lot of info on that for you.
Great. So I just posted one article in the Q&A in response, but Julie has many, as I do. I've got many articles, but this one's on the top of my mind, even though it's 11 years old, but it was about celiac disease and non-celiac gluten sensitivity and psychiatric conditions. And when you read this, the references in the back, they say, well, in this study of schizophrenia, the guy got completely better on a gluten-free diet. And this study on autism, 86% of the kids got better on a gluten-free diet. So it's a summary paper that I put in there. And of course,
great.
Julie's event, who we should be posted already. I think I saw it already. It's in your link there for her event that's coming up. And Julie, let's talk about the event for a couple of minutes. What's the messaging or what's the center of focus for this event?
So it's all about personalized nutrition for improving ADHD, autism, anxiety. There's even a great talk on Down syndrome. So looking at these pediatric neurological conditions and how we can use food and nutrition to help improve them. We have pediatricians, various doctors, PhDs sharing their, and nutritionists sharing their experience and research and all sorts of things on how to help families navigate this. It's for parents and practitioners. So there's a variety of different talks for all different people of kind of different, depending on where they happen to be in their knowledge level.
Marvelous. I'm going to post another Well, I'm actually not sure. And I'll put it in the chat and then you'll post it if you would, please, where it's supposed to go. And if you put that into just Google, it'll come up with the study link also. But this is the doctor that I interviewed yesterday, David Furman at the Buck Institute on Aging in Novato, California. And David Furman is the go-to guy. And Anne, I'd like to share a screen. So if you can give me permission to do that. Because in this paper that I've just given you the name of, and Anne's going to put the link there, his messaging is, and they've done so much research on this now, it's irrefutable that chronic inflammatory diseases, diabetes, Alzheimer's, depression, anxiety, cardiovascular disease, cancer, autoimmune diseases, Hashimoto's thyroid, doesn't matter. They are all chronic inflammatory diseases. So I'm going to share my screen to show you this picture from his article. And I gave him just a big compliment and said, this is just the best article. Thank you so much. And I want to show you the one on the left here, because this center circle, an SCI, is systemic chronic inflammation. And everything on the left side here is what contributes to activating our immune system, trying to protect us, whether it's infections, bacteria, viruses, molds, fungus, inactivity, obesity, a gut microbiome way out of balance, your diet, too much stress hormones, not enough sleep, or chemicals from the environment. And it's a combination of most of these for most people, but that environment turns the crank on the wheels, producing the systemic chronic inflammation. And then depending on your genetics and how you've lived your life so far, that determines where the weak link in your chain is. Is it going to be diabetes or cardiovascular disease or cancer or depression or autoimmune diseases or neurodegenerative diseases or osteoporosis or immunosenescence, your immune system just falling down on you? That what manifests later in life that we're so concerned about, and we ask, what pill can I take for this, is actually the end result of all of these things that have been going on for 20 or 30 years under the surface while you felt fine. And what Julie talks about is about the inflammation on the brain, mostly for children, but also, if I understand correctly, also with adults. And she's talking about inflammation and how it affects the brain. And this article by David Furman goes into a lot of detail about studies that show how inflammation affects the brain, from schizophrenia to Alzheimer's to attention deficit. So you'll see a lot of references in there also. Great. What are your thoughts on Vanderbilt assessment and or QB test for attention deficit? Let's just start with that one first.
I don't know. Tell me, I don't know if I know anything about that.
Neither do I. I don't know. That's why I just passed it over to you right away. I don't know what the Vanderbilt assessment is. I'm sorry, I can't. Neither of us can comment on that. When do you believe attention deficit medication is appropriate in your mind? Well, let me tell you my impressions of that medication, and then Julie can take over on this one. But I want you to understand what Ritalin is. Ritalin is an amphetamine. It's a speed. Now, wait a minute. Why would you want to give my child speed if they're already hyperactive in their brains and they can't sit still? Why would you want to do that? And the analogy I give is that I owned 13 cars when I was in college that cost less than $100 each. I'd buy a car for $75. It would run for 3 or 4 months and then it would die, right? You know, you didn't have any money, and so, but you have to get to work and to school. And those cars often needed tune-ups. Sometimes it was so bad, you pull up to a red light and the car would stall. It needs a tune-up so bad. So what do? You push the clutch in and you rev the engine a little bit if it's a stick shift, or you put it in neutral when you're coming up to the light and rev the engine a little bit. Now you're not hot rodding, you're just trying to prevent the car from stalling. And then light turns green, you put it in drive and off you go. Children's brains with attention deficit are not functioning adequately. So what do? They rev the engine. They give them speed, which will help them then slow down a little bit and maybe listen a little better in school, maybe sit quietly, which I'm not sure is a good thing, but that's the goals, for teachers most of the time, is that they sit quiet and learn, right? But they give children speed so their brains will calm down, because the hyperactivity is often because of a lack of blood flow getting into the brain. That's called hypoperfusion, not enough blood flow. And when you give Ritalin, you increase perfusion into the brain. There's more speed. There's faster circuits going. So that's the one component that I wanted to talk about as to why it works sometimes in the short term, but not in the long term. Julie, do you want to take over from there?
Well, that's a good, medication is not my specialty. It's not my scope of practice. So my experience is a little bit more from parents that didn't want to do it.
Of course.
And wanted to do a more natural approach, and I think one of the benefits of more of a natural approach is that you're attempting to get to the root of the problem or the underlying factors. And so that's kind of where I'm always looking at, is there that inflammation? I'm curious from your perspective, is this perfusion due to inflammation? Do they know?
Yes.
Okay.
Yes.
Well,
almost always.
Interesting. So that's the kind of thing I think of it as a nutritionist. What's the mechanism behind, or what are the underlying factors behind what's going on for them? And what's the mechanism of action of the diet that might be able to address those underlying factors and help improve things from the bottom up?
Right. Agree. Completely agree with you on that. Do you think the GAPS diet can help with autism and attention deficit?
Yes, I think that it's a great diet. I think that every diet, well, I shouldn't say that. I think depends on the person, whether it's the right diet for an individual, but I definitely think it's a great diet. And for some people with ADHD and autism, it's a really good diet. We actually have on, I don't even mean to bring up the forum, but we have such amazing people on. We actually have a woman that was a graduate from the program. She's a bio-individual nutrition practitioner, and she's also a PhD. And she did 2 research studies on 2 clinical trials on the GAPS diet for autism and then the GAPS diet for ADHD. And she found very good results from them. So I do think that it's a good diet for both of those.
Yes, I agree. And, that diet was designed because my friend, Dr. Natasha Campbell McBride, who founded the GAPS program, she was a neurologist, a functioning neurologist, and her son developed attention deficit, severe attention deficit, pretty close to the Asperger's and moving in that direction of the spectrum. And she said, but this shouldn't happen. This doesn't happen to a child at a certain age. Maybe they're born with a problem, but her son wasn't. And so she did the deep dive research, just stopped everything to help her son function better. And thus was born the GAPS diet. And she has thousands of practitioners all over the world who are using her protocols for that. Mm-hmm. So yes, it can be very helpful. Let's see. Are you allowed to recommend specific tests for evaluation of food sensitivity? Sure. They're called the Zoomers because you zoom in on the problem. I wish that was not the name. It's kind of a marketing thing, but that's what they called them. So there's the wheat zoomer, the dairy zoomer, the corn zoomer, the egg zoomer, and they are the most comprehensive tests in the Western speaking world. I've not been to China or Japan, can, but they are the most comprehensive and the most accurate of anything else that's out there. And they have some package offers that they'll give. And so Ann will put a link in here and you can look at it, or you order 5 and they give you 1 or 2 free. I don't know what they are, but they're encouraging people to do more of the tests. And they've had now hundreds of thousands that have been using these tests in the last 7 years. So they're accumulating a big database. And the papers that are being published on that are showing for cardiovascular health, for wheat-related disorders. There's no other tests that give this kind of information with this accuracy. How would you effectively communicate with a teenage boy who is resistant to the idea of eliminating gluten from their diet, despite understanding the potential positive impact it could have on their attention deficit or anxiety?
Oh, teenagers in general are a hard one, just in general, to get them to change their diet. But it's a good question because I think it's a very empowering and powerful age to help them. And so I think your question is a good one. I mean, the first thing I would do, sounds like maybe you've tried, which is to try to find some leverage. So why do you think the diet would be beneficial? And is that something they are concerned about? So I don't know, maybe they aren't concerned about, maybe they're not so concerned about one symptom, but maybe they're more concerned about something else. So maybe they're more concerned about their acne or embarrassing gas than they are their attention or something. So if you're noticing something, how can you explain, here's potentially what these foods can do? Why don't we give it a try? And then find a limited period of time to give it a try. Say, hey, let's try it for a month and let's see how it goes. And, you can decide, do you want to do some sort of celebratory thing, not a food necessarily, unless it's a, gluten-free kind of a food thing. But, after this, let's go do a favorite activity or something. Let's try it out, or let's just try it out because it's good for us to learn about these things. And,
right.
If you put a container around it, a period of time. Also, if you talk to them about what are they concerned about? I don't want to do it because I want to make sure I can have pizza with my friends. I want to do it because I want to make sure I can go to the arcade with my friends, or I don't want to miss the birthday party, or whatever it is. Then you can say, all right, let's find solutions for that. So what can you get at this restaurant if you want to go with your friends? What could you bring to wherever you might go? The movies or, those kinds of things. So how can you, and I do this with clients, with adults all the time, it's hard to get anybody to change a diet to some extent. And so I'm always asking, what is your main concern, fear, worry, whatever it is, and then work with them to help them figure out what that is. That's my favorite thing to do, because you might find out it's something different than what you think is important. And by understanding what's important to them can help them see the value.
Right. Great. What to do when autistic client has severe reactions to quitting dairy and gluten, kicking, biting, screaming, self-hitting. And Julie touched on that a little bit, that once you do the testing, if they come back and they've got elevated antibodies to any of the opiate receptors, gluteomorphins or prodynorphins, if that's one of the components of wheat that they have a problem with, then when you take wheat out of their diets, they're going to have cravings. And those are the people that you would say, let's start with twice a week with the gluten-free diet. And once you've got that down and your child's eating those foods, then we'll go to 3 times a week. And then we'll go to 3 times a week and 1 lunch a week. And so, just start slow. You slowly step it up. And that's the telltale sign of when you have to be gentle with transitioning to a gluten-free, dairy-free diet, is when they've got elevated antibodies to gluteomorphins, prodynorphins, or from dairy, casomorphins. And so that's, you can't do it cold turkey, as evidenced here. That's usually why that happens.
Mhm.
And you'll find that if the parents have patience, but every time I give him wheat, I know that he doesn't function well. Yes, I know, but we need a transition in a way. You have to find what foods he will eat, what consistencies of foods, what flavors of foods that he will eat. And that's just going to take some trial and error. But so in the
Mhm.
meantime, don't throw him off the deep end without a life jacket.
Mhm.
Really, really important. Julie, anything you'd like to add to that one?
I completely agree with what you're saying. And I might add a little bit to that is to find things that they like before you take out the things they're eating now. So part of it could be if we take out all their favorite foods, then there's nothing left. So if we could add a new gluten-free pasta before we take out the gluten pasta, if we can find a new bread or a new this or that that's within the diet compliance of gluten-free and dairy-free, then at least there's more familiarity once you get to the removing of certain things.
Right.
But you're very much right that sometimes I see reactions as a good reason they might really need or do well on the diet. But like you said, the transition is where the challenge lies. And I love that idea of going low and going slow, possibly adding other new things first. I think those are really good ways to start that.
Good point. And there's no such thing as a cheat day. There's no such thing as a low gluten diet. You may begin a low gluten diet for transition, and that's perfectly okay. It can take a month, 2 months, however long it takes. Who cares? Because you're working on the rest of their lives.
Mm-hmm.
So it depends on the individual. So it may be a low gluten diet transitioning, but it's never, ever giving the patient the impression that a low gluten diet is okay.
Mm-hmm.
No, it's a step in the right direction going towards a gluten-free diet.
Mm-hmm.
That's the only way to approach this. And that's because you make memory B cells to eat. So if there's any scientists out there that are saying, I'm making these grandiose statements. No, it's that you get memory B cells, and any exposure you get activates an immune response, and elevated antibodies will be there for 60 to 120 days from one exposure, just one exposure. And so you want to do it slower. So transitioning is a good idea. Let's see, what about FODMAPs and the FODMAP diet of Monash University?
Yes, I mean, I think this is definitely one of the diets that I like, that I use to help people refine their dietary strategy. Like any of these diets, some people really benefit from them. Some people don't so much. I think FODMAPs are something that could be really good for people and really bad for other people. So fiber is really good to help feed the good bacteria. But if we have an imbalance of bacteria or, various types of dysbiosis, then we might not do well with those FODMAPs or that fiber. So for some people, getting more fibers super helpful. For some people, getting that higher fiber can really cause symptoms. So it really is going to, again, depend on that individual. But I have seen good things with the low FODMAPs diet. I think Monash University is really the leader in that diet. There's a great process to it. They've got great food lists. I think it can be really, really helpful for people that don't know. FODMAPs are fermentable carbohydrates. So they are various types of fiber and other types of carbohydrates like lactose and disaccharides and certain things, even some monosaccharides that are found in certain foods in higher quantities than others. And by eliminating them or significantly reducing them can really help with digestive symptoms. And then because the gut and the brain are connected, once we help improve the gut and we can reduce inflammation, it can really help all sorts of different systems.
Right. Monash published, I think it was about 2017, maybe 2018, and they said no effect of gluten-free diet with patients that had irritable bowel syndrome versus the FODMAP diet. And so they broke them down, people into different groups that had some type of abdominal complaints, irritable bowel syndrome, some bloating, some gas, sometimes severe pain. Some of them they gave a FODMAP diet to, some of them they gave a gluten-free diet to. They said there were no effects of a gluten-free diet for the people with IBS. And that actually wasn't true. If you read the paper, 8% of the people got completely better on the gluten-free diet. Now, the FODMAPs, it was over 60% of the people got better. But the title was a intentional manipulative title to distract people away from gluten-free and focus on FODMAPs. Now, FODMAPs are important to focus on, but they're titled No Effects of Gluten when 8% of the people got better on a gluten-free diet is just poor titling.
Yeah.
That's a little segue side note for geeks. You know, I don't like that they did that because so many people had the impressions that gluten wasn't a problem if they had IBS, and that's just not true.
Wow.
But the reason that FODMAPs have such a higher level of response when you go on a low FODMAP diet is that these FODMAPs, these fermentable carbohydrates, well, you eat these carbohydrates and they feed the bacteria in the gut, but they also ferment in your gut and they cause gas, they cause bloating, they cause pain. And it turns out, and many of our followers have heard this before, it turns out that it's the FODMAPs in wheat that cause the gut symptoms, the bloating, the gas, the pain, not the glutens or the other proteins. The glutens and other proteins cause an immune response, which sets you up for autoimmune diseases and brain cognition problems and depression and anxiety. The FODMAPs don't do that. It's the proteins that do. But the FODMAPs have the majority impact on how your gut functions if you have a FODMAP sensitivity. That's why you can go to Europe and eat the wheat and not have any symptoms. You don't get any bloating, whereas in the US, you eat a pizza, you get bloating and gas and feel terrible. But in Europe, you don't, because the wheat there is lower in FODMAPs. And so you don't get the gut symptoms, but you still get the immune symptoms. You still activate the inflammation. You just don't feel it the way you feel it when you are exposed to something with wheat in the US. So don't be fooled by that you don't feel it when you eat a pizza in Italy. So it's not a problem. You can't interpret it that it's not a problem. Yes, it is. It's just not giving you the gut complaints on that one.
Interesting.
Let's see. Nick is asking, are you diabetic? I assume you're asking Julie. Julie, are you diabetic?
Well, it's a bit of a medical question for me, but no, I'm not. No.
Right. Yeah. Actually, that's personal information that you may not want to announce. I'm sorry I asked you.
It's okay.
But I'm not. No. But that brings up a topic that I wanted to address for all of our people here watching these Tuesday night things, is that everyone, without exception, will benefit from getting what's called a CGM, a continuous glucose monitor. It's like a nicotine patch. You put it on your arm, and then you take your phone, and it'll tell you in real time what's your blood sugar level. So you don't have to poke your finger anymore. And they last a couple of weeks, and so you can use it 4, 5, 6 times a day, every day. So when you eat oatmeal for breakfast, what happens an hour later to your blood sugar? When you eat pancakes for breakfast, what happens an hour later to your blood sugar? And nothing that I can think of will give you as much real-time data, usually drops your jaw, as when you wear a CGM for a couple of weeks. Now, some people wear them longer, you know, they'll get them and wear them for a few months, but you know, for most people, at least you'll be validated if you do the expense, and they're not expensive at all now, and the app you can download for free. And so you just put the patch on, and you can check it anytime, day or night, so you can see when you wake up in the morning, where's your blood sugar when you first wake up. And people who wake up with headaches, that's a classic reason for headaches. is that their blood sugar has dropped severely, and in the morning. So getting a continuous glucose monitor for our anonymous question, no, for Nick on Facebook. Nick, so there's something about blood sugar perhaps that you have some interest in. I'd suggest a CGM. I think you'd be really startled by what you find out. Anonymous on Zoom asked, how do you determine the unique mechanisms in each unique individual to then develop a personalized nutrition solution?
That is a really good question. It's, you know, over the years, I've created a whole kind of methodology and way of thinking about it. So it's probably a bit much. I mean, it's something we spend dozens of hours talking about in, you know, my training, but I'll give you the gist of it. I mean, it's a combination of what symptoms do people have? What conditions do they have? What do their labs look like? What do their genetics look like? What does their family history look like? What might have been their experience in childhood? What foods do they eat a lot of? What foods do they have reactions to? All of these things give little clues to what might be going on for somebody. And putting those all together helps someone figure out what the best dietary approach for them is, as well as then maybe some dietary trials and various other ways of kind of fine-tuning it. It takes some time to come up with some suspects, try some things out, figure out what might be going on. And it's evolving. So there might be something that someone starts with, but then maybe they work on healing that part of their system up, and then it might highlight something else, or then they might be able to work on something else. So it's really a process over time. But that's a bit of the process, a bit of what I would kind of typically think to look at when I'm figuring it out. So yeah, I would say that.
Yeah, good. Okay. And my component to that, I agree with what you said. And also my rule is test, don't guess. You test, and you test to see, is their immune system fighting wheat? Well, what about dairy? What about lectins? Do they have a leaky gut? Do they have markers of a leaky gut? And what's their stool analysis telling us about the diversity of their microbiome? So we start with the big boys first. And then if need be, we'll do more sophisticated testing. We also look at the number of nutrients, vitamins, and minerals that a person has in their body with the current lifestyle that they have. And then from there, you then determine, okay, it looks like we need to get more zinc and selenium in here. Mrs. Patient, having 3 Brazil nuts a day is all you have to do to get plenty of selenium. Now, I'm going to recommend you take a bottle anyway, now, just to pump it up really quickly. But if you can include 3 Brazil nuts a day, maybe you dice them up and put them in a salad, maybe you throw them in a soup, maybe you just eat them raw, it doesn't matter. You'll get your daily allowance of selenium from Brazil nuts. So you teach them, but test, don't guess is to develop a personalized plan. You have now, if your personalized plan is going to be based on how they feel, if that's it, then you don't need to do any testing. You can just shotgun and people start to feel better. But the purpose of testing is that you retest afterwards. After they're feeling great, you retest to make sure you fix the problem completely and that it's still not there, or else it'll come back and it'll catch up with you somewhere else. Julie, let's take a minute and talk a little more about your event coming up. Tell us what your purpose is in doing this and what kind of messages have come out from this event.
I really want to empower parents and practitioners to be able to firstly realize that food and nutrition can really be beneficial at improving ADHD and autism and anxiety and these types of things that can have a serious effect on children and, as you mentioned, even adults, and really can affect their lifestyle. And that these approaches can actually help no matter what age you are. So in our study that we did that you mentioned in the Journal of Nutrients a few years ago, we had children that were 3 all the way up to age 58 years old. And even the 58-year-old got benefit. So I really like to, encourage people that it's never too late to do dietary intervention. You can always, it's always possible to get benefit. It's never too late to possibly improve. So, that I think is an important message that I like to share, that diet and nutrition can help these conditions, that as we heal and work on making the body healthier and functioning better, then that will help the brain. Those I think are a couple key messages that I really like to point out, that there's science behind it, that this has been being done for many years by many families, many clinicians, many individuals. And so I think those are probably a couple of the key aspects, I think, to the event that I'm looking forward to sharing with people.
Marvelous, marvelous. And the link is here for that. Please, everyone, register and support Julie in this by registering. And you may read on day 3 that you haven't had time to watch any of it. But now on day 3, the titles of the talks of the people who were interviewed and aired on day 3. So, oh, I've always wanted to learn more about that. And that's the one you'll listen to, or 2 or 3 or 4, whatever it should be, or maybe one, I don't know, maybe one a day. But the point is, when you register, and it's all free, so you'll be able to be notified of who's coming up that day.
Absolutely. There's about 5 talks a day for all 3 days, and lots of things for everybody. We're going to talk about mitochondrial function and health, the microbiome, the gut, different dietary strategies like the GAPS diet we talked about. We're going to talk about gluten, therapeutic diets, picky eating. So there's a little bit of something for everybody.
Can you please talk about stuttering? Is this a sign of autism or ADHD?
That's a great question. And stuttering is not a part of the autism diagnosis. It's not part of the ADHD diagnosis either. I don't know if it's a comorbid condition. I haven't heard of it as a common comorbidity in autism. I would imagine, I'm not that much of an expert at stuttering. I would imagine that there's a neurological component and that there might be some overlap and maybe some increased co-occurrence, but I'm not too familiar with it. Do you know?
Well, Julie, you hit it right on the head. That it's an inflammatory condition where a part of the brain is not sending the messages clearly down to the tongue. And it's an inflammatory condition. So if you notice that it fluctuates in its intensity, you start playing detective. What did I eat before that, or in the last 48 hours? What have I eaten in the last 48 hours? And the next time it gets severe, what did I eat in the last? Oh, wow. Tomatoes were both times that I'm keeping track, in tomatoes both times. You'll start to find where it's at for that contribution. It's not just a food sensitivity, of course, because there's colorings, preservatives, gums, lots of different things that are being thrown in our food now. Many of them can have an impact on your nervous system, your brain and your central nervous system, and how it functions. So that's a critically important component of all this. The answer, can stuttering be a part of attention deficit or autism? The answer, absolutely yes. That when you have either of those conditions, it's not just one symptom. There's a group of dysfunctional symptoms. And just imagine if you've got that. Could everyone cross your legs, please, for a minute? Just cross your leg if you're sitting, and not if you're driving, but for everyone else. Leave them like that for 3 hours, stand up and run.
Right.
You can't. There's not enough blood in the legs. That's what low perfusion, hypoperfusion is on the brain. It's not possible to function properly. And so that's a strong component that comes from inflammation, that comes from some exposure, some environmental trigger, either toxins already stored inside our body like lead and mercury and organophosphates and pesticides and insecticides, or something in what we just ate. It could be one or both. But that's a critically important concept, is look to see if there's inflammation and what the triggers of inflammation are.
Thank you. That's really interesting. We have tics or Tourette syndrome is much more common. And so I've done some research on that, and there is a percentage, and that makes a lot of sense what you're saying, because it's kind of similar, right? It's having an effect on the brain and the way that the body is functioning. In this case, it's the way the tongue is functioning. So that definitely makes a lot of sense.
Right, right. If you do the Zoomer test, you recommend adding the sensitivity test in addition to the Zoomer test and the immunoglobulin test. The immunoglobulin test, yes. The sensitivity test, mostly for elders or people who are really sick. But the immunoglobulin test means how many immunoglobulins do you have? There's three major categories: IgA, IgG, and IgM. And they test the total immunoglobulins for all three. And the Zoomer tests are looking at immunoglobulins to different parts of wheat or to dairy, different parts of dairy. But you're looking at these immunoglobulins, these bigger special forces of the immune system going around looking for what they've been programmed to look for. And when you're using immunoglobulins as your indicator of increased activity or not increased activity, you have to make sure you've got enough immunoglobulins. So if you're low in immunoglobulins for whatever reason, so you've got low secretory IgA or low IgG or low IgM, and then you can't use the immunoglobulins as the marker, is this okay or not? Because you're not making enough immunoglobulins. So you look at the total always to see and make sure that there's enough adequate amounts of total immunoglobulins. Then you're looking at immunoglobulins, the IgA, to gluten or to casomorphins in dairy. But you can't look to the IgG or the IgA of anything if you've got low levels of total immunoglobulins. It just doesn't make sense. So yes, you always include the total immunoglobulin test when you're doing a Zoomer. A question on Zoom: how do you remove heavy metals? Julie, do you work in that area, reducing heavy metal accumulation in the body?
I don't work so much directly with it. I leave that a lot to the physicians I work with. I feel like heavy metals are very important and serious to do properly. And so I like to leave that to the experts.
Right.
I tend to work more on how do we get the body functioning well, the liver functioning well? How do we get, just the body and the organs to just have the nutrients they need, and leave that to the experts.
Right. Excellent. Well, the first thing in detoxing, any detox program, is that you have to have the highway open to detox. That if you've got a 4-lane highway and it's down to 2 lanes right now, everything's moving really slow because there's so much crud in there that it's just blocking the highway and you can't get this stuff out very easily, then you don't want to be doing detox if you don't have an open pathway for detox. What does that mean? Couple things. First, are you hydrated well enough? Just pinch the back of your hand. And if the pinch stands up, you're dehydrated. That it should go flat immediately, just like that. You pinch, it should go flat. But if you pinch and you can see a pinch for like a second or 2 seconds, you're dehydrated. It's an easy, just screen that you can do. And the amount of water you need to drink is a, Marzi just threw a pool toy at me because she and Gio are out in the pool right now. And I've been watching him with his little water wings on. And she went, because it's time to go. She wants to be in the pool. But the amount of water is 1/3 of an ounce per pound body weight. And if you're perspiring quite a bit, like you're using infrared saunas or regular saunas, or you're exercising and your exercise clothes are drenched when you're done, so you're sweating a lot in your exercise, or you're doing hot yoga, not regular yoga, but hot yoga, and you're just pouring out the sweat, it's 1/2 ounce of water per pound body weight. So 1/3 of an ounce in general, and that's just to make sure the highway is flowing, that all the lanes of traffic are open. So as you start mobilizing all this stuff, you can get it out of there. And here's a simple component of detoxing that's been shown time and time again in the science to really work. And that is eat organic. When you eat organic, you find that your urine tests and other mediums, blood, and I believe breath also, that when you start organic, there's lots more of these toxic chemicals in your urine than ever before. Why? Well, you're not getting them from the food you're eating or the water you're drinking, that you're getting rid of what's been stored in your body. So that's a really good thing. So water, adequate water, and eat organic as much as you possibly can. And you have to be fanatical. I mean, the studies on organic have even shown that 3 times a week, and you get dramatic results compared to people who are just eating conventional and no organics whatsoever. So you'll increase your elimination of the stored toxins. Well, Julie, my family's calling, and it's just great. It's just great that what you're doing. I mean, this is a very specific event where you're really focusing on attention deficit and autism. And I would suggest anyone with brain function imbalances of any type, depression, anxiety, schizophrenia, bipolar, that you're very likely to pick up some pearls in this event. So once again, please register, and you'll see a title of a talk that day. So, you know what? I wanted to learn more about that. And then there you go.
Yes.
So,
well,
Julie,
thank
you so much.
Thank you so much. Tell Marzi I said hello. Give Gio a hug for me.
I will. Thank you so much. All right, everyone, and thank you. We'll see you next